Good morning, everyone. Dr. Boris Nektalov from Nektalov Health and Wellness Center. So today we're gonna go a little bit off topic and go into the breast cancer month. So very interesting happened to me with one of my patients. Not long ago, she came in for back pain, and when we were doing consultation, I was going through her history, and she mentions that she's a breast cancer survivor. Okay, so she went through chemotherapy, radiation, and it went well as far as they cannot find. She's in remission now. Now, she comes in with the back pain now. Now, as you guys know, and I've mentioned many times, we don't treat cancer, diabetes, any of those diseases. So, but we do address the cause. And what is the cause is making sure that you're getting a strong immune system, right? Good nutrition. Not per se that's the direct link, but when your immune system dies, many degenerative processes start to begin. So when I started going through her history, she telling me she survived breast cancer. But nevertheless, she went through all this treatment, right? Medical treatment that was very successful for her. She's now feeling a lot of lack of energy. Her life is not the same. A lot of emotional stress, nutritional stress. And now she's asking me, she's been following me on Facebook and hearing us talking about nutrition, chiropractic, spinal health, emotional health. So what can we do for her? So there's a lot that we can do for her that I explained. And I like to use this analogy that I like to share with you. When you have, imagine you have a house, it's on fire, okay? And the firemen come in, they bring what? Chemicals, they bring water, they just literally save the house, but they break the whole thing in order to save it, right? This is what chemotherapy or radiation does to the body, right? They try to save your life, kill the cancer, but along the way they break down your immune system, your digestive system, your hormonal, everything is off track. Now that the firemen saved the house, now what? You have to rebuild. So what do you need in order to rebuild? You need what? Building materials, right? Bricks, wood, and to put all that together, what do you need? You need workers, right? So in our body, what is it, these materials to build? Protein, building blocks, right? Carbohydrate, lipids, vitamins and minerals. They're co-buildings. So you cannot build your health based on just vitamins or minerals. So what you do need is building blocks, nutrition, right? So, but who builds it is enzymes, right? Just like you need workers to put the bricks and the wood to fix the house, you need workers to build your health again. Now, remember, I always preach and talk about that. Our body, our life, everything runs on energy. We need energy. Without that, nothing happens. Where do we derive energy? It's from what? Carbohydrates, number one source. If we don't have enough energy, your body starts to break down muscle and fat for energy, right? We need energy to breathe, to beat, to have a good life. Nevertheless, somebody has to perform that work. It's enzymes, and we talked many times about the enzymes, right? So what do enzymes do? They digest, pre-digest, digest, they absorb, they transport, and they allow your cells to utilize the nutrients, the macronutrients. Remember, our body makes enzymes. As we age, we deplete them. We're supposed to also get enzymes from foods, like fresh and raw vegetables have lots of it, right? So if we start cooking them, we're killing them. We're killing the workers. So it sits here. Many people, like this person, she tells me, she gets bloated. She has acid reflux. She's been diagnosed with IBS. So all these stuff is due to lack of or deficiency with enzymes. You need workers to put these macronutrients into building, right? So again, why? So one of the things that I always mention is that we're supposed to get the enzymes from food, but nevertheless they're not there. And why is that? Just recently, I saw an article. They're saying by 2030, the amount of food that we produce, we need to double it. There's no way we can produce all these foods. There's so much waste. So what do? They use enzyme inhibitors, right? So the foods that have enzymes, they have to inhibit those enzymes. Why? They would rot. So in order to have a longer shelf life, we have to stop those enzymes from killing it or digesting the foods. Otherwise, it's not going to last longer. So enzymes inhibitors are being put in intentionally in order to last longer. Otherwise, we cannot produce so much food. So we have to supplement. Therefore, we do have to supplement with enzymes in order to achieve a good health. Now, if you have any questions, if anybody on it right now, I would like to hear it. Please send us questions. Follow us on Instagram, Facebook, YouTube, and what's the other one?
Twitter.
Please visit our website. I'm waiting for questions. If not, we'll see you guys later.